Welcome to Why Where Matters. My name is Paul E. Zieske, and this is a place where we tackle the complex world of location-based services by open sourcing a concept we call enterprise traffic control. So I'm excited about today because we've explained that there's these layers of abstraction that are important as we get into this new world of AI and digital twin. And abstraction can be a bit frustrating for us because we all want substance, but today we're going to get into some of that substance. But I think we should set the table a bit and go back to our definition of enterprise traffic control. So enterprise traffic control is using situational awareness and automation to optimize mobile workflows across the enterprise. And today we're going to look at an example of an automation. And in this case, we're using automation as a noun. Today we're going to look at the definition because we want to show the shift from a reliance on humans and situational awareness to machines and the predictability that we get from the automation. Automation involves a journey, and it starts out simple and it builds incrementally, and that's what you want when you're trying to execute an organizational change. It's much easier to get it to stick if it happens over time. In this discussion today, we're going to talk about the people and the process just as much as we're going to talk about the technology. And today, we're going to talk about the sterile cycle for IV pumps in the hospital. So let's get into it. The centralized sterile cycle for IV pumps is an interesting place to look at enterprise traffic control. It's not extremely complicated by itself, but it involves interdependent workflows and handoffs. And from our ontology, we've defined those handoffs and these interdependent workflows as orchestration. It's very interesting because you have two cycles that are operating independently of each other, but they are dependent. You have the sterile cycle that's being done by one department, and then you have the nursing use cycle that's being done by another department. And we aren't going to take on orchestration today. We're going to focus on the automation. We can't overemphasize how important it is to have IV pumps for the nursing units. It's so important that when there are shortages, the nurses will hoard them and they'll clean them in place instead of sending them into this cycle because they're afraid they're not going to get them back. So there's this trust component to it. And when you think about it, that's them putting their patients first, but there's a risk to it because keeping them out of the cycle, the cupboards are bare for the other patients and the units that are properly using the cycle. So what is a sterile cycle? According to regulations and manufacturer recommendations, the pumps need to be cleaned and inspected after each use on a patient. There are contaminants that can get on these devices from the skin flora, they call it, and the room itself. A centralized team is established that's a part of the infection control entity to address how you clean these devices. And they're responsible for retrieving and the cleaning, and sometimes they're also responsible for distributing back into the nursing units. This can be broken up a variety of different ways, but the cycle usually repeats the same. So this might start to sound like a supply chain workflow, which it does resemble, and supply chain even does the distribution in some of the hospitals, but it's more complicated than consumables because your supply comes from a stock that you have to create yourself from a limited resource, which is the dirty pumps. Dirty pumps are supposed to be put in a designated location by the nurses. So this is a different team. That location is a soiled utility closet, and that's used for things that are contaminated in some way. Everything can work pretty well if the nurses can trust that giving up a pump into one of these soiled utility closets will result in them getting a clean pump back when they make that phone call to supply chain. But anything that breaks the flow breaks the trust in the cycle, and you get this vicious cycle of hoarding because you don't want to give up a pump that you might not get back. So you might say, why not just let the nurses clean the pumps? And there's a lot of good reasons to have a central sterile cycle for IV pumps. Sometimes the nurses don't clean them properly and they use the wrong chemicals. Also, those chemicals need to be kept in a central location. There's issues of oversupply. The oversupply causes an additional amount of maintenance that needs to be done on those devices, and it drives down the utilization. So one estimate we saw was $1 million per year in a hospital that was about 1 million square feet. That's about an average size hospital. So the economics are there. The location services 1.0 way to solve this is to install an RTLS and create situational awareness for the central sterile team. And this will show where the pumps are at, and in a well-run sterile cycle, you can even do some manual par stocking with that tool. It sounds simple, but it's not. It becomes a huge change management issue for the organization. If you're going to do par stocking Where are you going to put the pumps? You'll hear that there's no room in the clean utilities. What are the PAR levels going to be? RTLS is very expensive, and if the PAR stocking fails, are you still going to get the ROI out? And this still breaks down if the nurses don't put the dirty pumps into the soiled utility closets, RTLS or no RTLS. Of course, the techs can play dragnet and find the places where the pumps are being hoarded with this fancy RTLS, but that's not what we want them doing. When you've spent millions of dollars on this RTLS, you really should be fixing the cycle and making sure that you can keep that healthy. Our digital twin involves three things at a high level: people, property, and places. That's the three Ps. We want to think of the three Ps when we think of the digital twin. So for people, we have the central sterile technicians and then the nurses. For property, of course, we have the IV pumps. And for places, we're going to have the central sterile department and the nursing units and the soil utility closets specifically. This is our digital twin. This is the physical objects that we're representing digitally. The people from this perspective are also called actors. They can be represented in software and with their location. Property be represented much like the people with the location and data. And the places, of course, will be our digital maps. So with that, we have a high-level understanding of our digital twin with these three Ps. And that's going to get us started. So we touched on the digital twin, and now we're on to automation. And when we create one of these automations, we're creating what we call a rational agent. And the rational agent is modeled using Ps, P-E-A-S, and that's performance measures, environment, actuators, and sensors. So for this workflow, we're going to be modeling the as-is condition, not the to-be or the automated condition of the workflow. The rational agent is designed to always make a decision that gets the optimal outcome based on the performance measures. So for this, we're going to have a situation where the nurse always has a clean pump. That would be a performance measure. We want the pump utilization to be maximized. We want to have the highest utilization that we can get. We want to have the central sterile operation to be efficient. So if we have all three of those things, we have a good outcome. And something like this, I would put in a worksheet for each one of these. The performance measures, the environment, actuators, and sensors. Put that into a worksheet so we can kind of see the landscape of what we're trying to automate. The surroundings of the rational agent are the environment. We need to have everything here to accurately represent the state of the environment. So we have the pump fleet, we have the central sterile team, we have the supply and demand. And I'm listing the supply and demand separately from the nurses like we did in the digital twin because the nurses have separate workflows. They have what we talked about is called point of use, and this is when we were describing what orchestration is. So for here, the most important thing that helps us describe the state that relates to the nurses is the supply and demand. Then we have the cleaning location and the pickup locations. This is a little bit like what we saw for the digital twin, but we're elaborating more here. So let's go on to the actuators. The actuators perform the actions that change the state, and the state reflects the positive outcome we're looking for in the performance measures. So this should all tie together. And this is the as is, right? It's not the to be. So all we have, of course, are people performing these actions, and they're doing the retrieval, the cleaning, and putting the pumps back into supply. So that's the actuators. Okay, sensors perceive things, and when they do that, we call that a percept. The sensors here for this initial state are going to be the human senses for the most part. I'll show you one that is a real sensor. But when you pair those human senses with the situational awareness that we talked in the beginning, that's how you get the outcomes in the environment that we're looking for in this initial state with very little automation. In this example, we have the technician seeing that the supply is low with their eyes. We have them seeing how many of these IV pumps are at the pickup location. They can bring them back. They can see the supply increase. They have some tools, but for this, we're looking at sight and situational awareness. And then we did add in one piece of technology, some barcode scanning, just at the cleaning location to show the devices going in and out of the cleaning. Okay, so now we have our initial state. We know a little bit about the environment, and now we want to see what tools we have to automate it. And for that, we're going to use the 4 Ps. And when you think of the 4 Ps, think of sensors. This is going to be an inventory of those tools and sensors. And these 4 Ps, of course, are specifically location sensors. There's other kinds of sensors. For this example that we're working through today, we have this toolbox of sensors, and we're going to use these 4 Ps to group them accordingly to their capabilities. And this helps us come back to describe in more detail the digital twin. And we'll start out with the definitions. Pardon if these are a little bit dry, but we need to be precise because we're going to build these in software eventually. Position is the location of an entity or thing in some coordinate system, and that thing has an identity. So we know which thing we have the position for. And then proximity has a source and a target. We have the position for the source, and we may get a range to the target. We don't necessarily need a range, but in some instances we will need a range. Presence tells us that some entity is in a particular space. We know about that space, and we know what type of entity it is, but we don't know the identity of that particular thing. So we don't necessarily need the identity. So if it was a human, we just need to know there's a human in that space. And then possession is when we've established the persistent proximity of an entity to another entity. Simply stated, that's just establishing custody. So possession is so that we can establish custody, and of course, kind of tools that we can build around that are chain of custody. With those definitions, we want to do this inventory of the sensors that we're going to be using, this toolbox that we have. The sensors will give us the percepts. The percepts detect the state of things in the environment, and the environment is what we described above in this PEAS, P-E-A-S. So for this environment, this example we're going to be working on, we're going to have indoor positioning, and that'll detect the position of the mobile devices that are going to be used to track mobile workflows. And this is a tool that we're going to have indoor GPS, and it's foundational to enterprise traffic control. So we're going to start out slow with RTLS. We don't need a full-blown RTLS, but we want to know it's in our toolbox and available to us if we want to track the location of the IV pumps. Proximity beacon asset tags that can be put on the IV pumps can also be seen by these mobile devices that also know where they're at. So we can get within proximity of an IV pump with an BLE asset tag on it, and if we know the location of that device, the position of the phone, we can also infer the location of this pump. That's kind of a mouthful, but we'll talk more about it in a minute. And then barcode scanning of QR codes in a fixed location. So you can put a QR code on a wall, and then you can scan that and then know where that QR code has been placed in the database. Then you can determine the location, and you don't even need indoor positioning to do that, but we want to make sure we have it in our toolbox. Okay, presence. In this example, we aren't going to do anything with presence, but in future episodes, we'll show you how powerful presence can be for some of these workflows. And then possession. Possession, we can do barcode scanning for the IV pumps into a virtual cart, and that's that association and persistent proximity that we can use in order to establish custody is what we're looking for in that. We say in our intro we're going to tackle this complex world of location-based services, and I love slogans and alliteration. You may have guessed that by now. They're good memory tools, and they help us simplify and make things more repeatable, and that's because we want to do this across many workflows. And that's how we're going to get to enterprise traffic control, is to automate these individual workflows, create these automations, and eventually orchestrate them together, okay? Maybe this is our first WhyWhereMatters slogan, and it's all about the P's. So when we think about the digital twin, we want to see what we're virtualizing, so we use the 3 P's. And when we're on to automation, we want to learn more about the workflows that we're automating, so we use PEAS. And we're going to need sensors to do those automations, so we have the 4 P's that allows us to do that inventory of those percepts that we talked about. As we get ready to get into the solution, let's start with another enterprise traffic control slogan, and that's mobile first and workflows last and last. What that means is that the Sterile cycle is a mobile workflow, so it should have a mobile solution. Also, if you want to change to last, you need to embed it into the workflow, right? The location services 1.0 way to do this would be to give the central Sterile team an RTLS, an expensive RTLS, and that would give them the situational awareness that they need to find the pumps. RTLS is a great tool for situational awareness, but to provide that kind of situational awareness without any workflow automation, you would need a location fidelity that would likely cause an RTLS to be installed that was up into the millions of dollars. Location Services 2.0 and enterprise traffic control is mobile first, and it uses low-cost workflow automation tools before we touch any kind of RTLS. Now, we could use some RTLS in this, but we would gradually get there. And that's the journey that I was talking about in the beginning, and this is the substance part of the discussion that we want to have, and I'm excited to get into it. Okay, so for this example, there's going to be two processes. One is the retrieval and cleaning, and then the other is the distribution. So Sterile cycle team is going to be retrieving and cleaning them, and then in this instance, the supply chain people are going to be distributing them. So they come from a soiled utility closet. There's a set list of locations. Then they come down to Central Sterile to be cleaned. They're scanned into the cleaning process. We talked about that a few minutes ago. And then they're scanned out of the cleaning process, barcode scanning. And then they're stored for distribution by the supply chain team. The amount that are needed for cleaning, everything's done visually. So they visually assess, like I said, the cupboards are bare, right? There's a shelving unit, and then you look over there and then you can see that the stores are low, and then you have to refill them by going out and retrieving them. On the distribution side, phone calls come in when they need pumps in a particular unit, and supply chain takes them out there. Okay, so this is the journey round one. Okay, so we're going to automate this retrieval and cleaning process first before we even look at the stocking. And what are our tools to do this? So we're going to have an indoor GPS system, or IPS, indoor positioning system. We're going to have barcode scanning on our mobile devices. With the indoor GPS, that means the barcode scanning is now location aware. And we can start with this. We don't need any infrastructure to do this, just this location aware app. So now when the tech sees that the cupboards are bare, they tell the app that they're heading out to do a pickup. And then they scan the locations. When they get to the pickup, they can either scan a barcode at the location. We already know they're there because we have indoor GPS. We can scan all of the pumps into a virtual cart. We retrieve them all. We bring them back to Central Sterile. And now we have data around where all those pumps came from specifically. So all these nursing units that we want to promote the good behavior for them to put the pumps into the soiled utility closets, we can reinforce that behavior because we already have the data. We know that the emergency department does a good job. We know that labor and delivery does a good job. We know the units that don't do a good job with that part of it. And we start this partnering with the nursing leadership so they can let the data be the bad guy. We said this hoarding thing was the dragnet. This is just the facts, ma'am, part of it. So just the data, no blame, and then we can move on. And this is all built into a workflow with no infrastructure. And remember, workflows last and last. So now we have an incremental change. We can observe the outcome. We can partner with nursing, and we can move on to the next step. In the previous step, we tightened up the retrieval and cleaning process. So now we want to look at adding some sensors, and these are going to be specifically to address any hoarding or the IV pumps that aren't making it into the soiled utility closet so that they can be cleaned according to the process. So what we do is we put these little BLE, Bluetooth Low Energy tags on the IV pumps, and the iPhones that we put in the previous step, they're location aware. They can find these devices. So this is, you think of the Apple AirTag, that's the way this works, but this actually works indoors. In this step, we can start to, say, snoop around looking for these hoarded pumps. And now we have a much better idea where they're being hoarded because we know from the previous step that there's certain areas where we aren't seeing any of these pumps coming into the closet. So we have much more data. We'll start to see more of these. We can continue our partnering with the nursing leadership. We can't be done here because we don't want our Central Sterile techs walking around with this dragnet approach to this. We want them to be doing their job. So we want to address both things. We want to tighten up the in process and we want to find the anomalies. Okay, so on to round 3. Again, we're partnering with nursing. We're going to observe the outcome from the previous step. We added that kind of AirTag experience to see if we could find some of the hoarding. We've already tightened up the retrieval and the cleaning process a little bit. And now we're going to add some sensors. So this is our first touch of RTLS. And so what we're going to do is we're going to put in sensors in the soiled utility only. So just those, let's say there's 32 closets, we're going to have sensors in each one of those closets so that we can see how many pumps are in those closets. And what that'll do, in the first step, what we were able to do was we were able to see how many were coming in and out, but only when we actually visited the closet. Once we have these sensors in there, we're going to see those pumps go into the closet, and now we can only visit the closets that have pumps, and we can make sure that we have enough cart space when we go out and pull those pumps back. The whole retrieval process is going to be much more efficient. And again, we're going to add in more and more data. Okay, so on to round 4. So now we want to look at the stocking side, and that's being done by a different team. In this case, it's being done by supply chain. And we're going to go back to what we did with the retrieval and cleaning, and we're going to do that in reverse. So we're going to have a location-aware app. We're going to have barcode scanning. And what we're going to do is we're going to scan the IV pumps into the virtual cart from the storage location, and then we're going to distribute them to the drop-off locations after the phone call to supply chain, just like it's being done now. But now we have data. Now we're tracking that. We have a location-aware app. We can see exactly where these things were dropped off, and we've added just that much more data. And now we've closed the loop, right? So we've done the retrieval, we've done the cleaning, and now we're doing the stocking. So the only thing that's missing is what we talked about in the beginning, is that we have the use cycle that's being done by the nurses. But we have a really good picture for the way that these pumps are being used. And two things we haven't done. We haven't done any par stocking yet. And we haven't done any full-scale RTLS with this at all yet. Okay, so now we have a very accurate health check. Okay, now we're on to round 5. We still haven't done any par stocking. We still haven't added any infrastructure except for in these utilities. We have added the tags to the IV pumps. And from our ontology, we've covered what we call nominal flow. That's the retrieval, cleaning, and distribution. That's the nominal flow. Now what we want to do is look at anomalous flow, right? So we're looking for anomalies. We know that when a pump comes off a patient, it's supposed to go in the soiled utility closet. So if that doesn't happen, that's what we're trying to detect. So there's some expensive ways we can do this. We can install a high fidelity locator system, and then we could see the pumps. But then we still have to get the pumps into the soiled utility, and it can't be the central sterile team that's doing that all the time. It needs to be a behavior change for the nurses. So let's take an incremental step and let's put in a sparse level RTLS and then just detect it in zone so we can see whether or not the pumps are moving in a department or a floor. This is a fraction of the cost of this high fidelity RTLS, and it's going to give us the data that we need in order to take another incremental step, partner with nursing. We still have the crowd sensing. We still have all those pieces in place. And that's going to be a way that we can get this change to persist. Okay, so let's do a bit of a recap. We did this PEAS exercise, and we did that because we want to be able to repeat this process over and over. We can imagine being able to do this for a lot of workflows that resemble this one. We just need the structure to make it repeatable. So our journey started with mobile. We did this location-aware app, barcode scanning, lightweight, easy to do, indoor positioning that allowed us to monitor the retrieval of the pumps and the cleaning. And then we added tags on the pumps, and that gave us the ability to be able to track them with the phone and to find some of the hoarding. Hopefully now we're seeing more and more of these pumps starting to come into process. Then we put in RTLS just in the soiled utilities, and that allowed us to remove a lot of waste from the retrieval process. Then we added the stocking, and we did the barcode scanning for the stocking in reverse, and that helped. Then we added the zone level RTLS to get the pumps and to look at these anomalies. And the whole time we partnered with nursing and we provided them data, and then we saw the behavior change. We didn't do par stocking, and it isn't because par stocking is bad. It's just because with these incremental changes, we hopefully got to a point where we had enough improvement to leave that much more complicated step for the future. And then really this exercise was to show how much you can do without having to invest a lot in order to get there. So I hope you saw how this enterprise traffic control approach is very different from what you see in the market now. It's really a journey of partnering all the way around. It's these incremental changes that are a part of an improvement cycle. It's Central Sterile partnering with nursing, but it's also the vendors that are willing to partner with Central Sterile to make incremental changes instead of trying to sell a very large, expensive system in the hopes that you're going to get the changes that you need. Composable is going to be the way that you're going to get there, and that's a feature of enterprise traffic control. So I'm very much looking forward to doing more of these kind of deep dives into some of these workflows, and then you can see the comparison between each one of these workflows and kind of how this structure is going to make them consistent, similar, and repeatable. I hope today you felt like there was some substance to what we talked about. I'm excited to do the next one, and thank you again for joining me on today's episode of Why Where Matters.